During Jakob Nielsen's Q&A at the first ever virtual UX conference, an attendee asked, how can design contribute to the current global pandemic of COVID-19 and help our users, our customers, and our communities?
I mean, of course, in many ways, this is not specifically a design or software user interface issue. It's a medical issue. But that said, I think there's a variety of different things that we can do. So going back to this point, it is a medical issue. There's a lot of researchers, medical researchers working on making vaccines or making cures and whatever. And those guys all use software to do data analysis and all of that. And most of that has terrible user interfaces. And so doing better in doing this kind of complex data analysis, we're actually working on doing a course on that that's going to be launched in a while. So we don't have that ready yet, and it's a very complicated thing to do. But for sure, doing better UX design on supporting active scientists in general, but maybe specifically the scientists working on this problem, is right there would be a good thing. Then there's sort of the more general thing about talking about the general public. And we know that right now we have all these software collaboration sessions that we're doing right now. And these systems can for sure be better. I think they're already actually pretty good for targeting users like us, but we're super users. So, we discovered a few small usability problems, like in Zoom, like we had a lot of people when they were trying to click the flag for their country, they clicked the flag for some like obscure little Antarctic island that had the same flag because it was a Norwegian colony, but it wasn't Norway. But this doesn't really matter, and it's a small thing. But there are small usability problems in software like Zoom or Slack, but they're actually honestly pretty well designed for people like us. But we are not the broad public, right? And so really driving through that now we are talking about a factor at least 10, if not more, of broadening the scope of people using this type of software. In particular, and that becomes a huge usability issue. And in particular, we are talking about a lot of elderly users having to use it now, who maybe didn't use these things before. We all know when talking about the specific virus that people 70 and older, particularly 80 or older, are the big risk group. And so they have to be like 100% isolated, and they can't meet with their grandchildren or anybody else. So that's super isolating and very hard for those people. And yet, design these days really is not at all suitable for old people. And we've actually worked on this for years, and we have done reports on how to design for senior citizens. We've done reports on how to design for teenagers. And honestly, which you did. And honestly, the teenager report is selling much better than the seniors report. Most companies don't care about old folks, even though we have data available on how to design for them. And I think now we really need to design better for senior citizens, because we have a lot of people, and they can't rely on the old solution, which is, my grandson, who's a nice young man, came by and set up my computer for me. They can't even rely on that anymore. So these interfaces have to be really, really simplified dramatically for the senior citizens to really use them well. So I think that's where, in terms of like more large-scale impact, maybe dramatic simplification of these type of interfaces, and particularly in terms of designing for seniors, which is so blatantly ignored, that we can do much better.